Hello, I'm Danielle Marks from Group 1, and today I'll be talking about changes in mental status that should be reported to the nurse immediately. First of all, we need to know what mental health means. Mental health basically is the absence of any mental illnesses. Therefore, it can also mean any disruption in the mental balance of the patient. This can be caused, mainly on a day-to-day basis, it could be caused by stress, where a patient, for example, be worrying about their hospital bills or about a disease they just discovered they had, for example, cancer. That could be, for example, one of the main causes of this change in the mental health. There are multiple types of mental disorders. Among them, you can have anxiety disorder, can also have among them OCD and phobias. There's depression, mainly caused by low self-esteem and poor coping skills, as well as any chemical imbalance in the brain. There's also gonna be bipolar disorder, schizophrenia, for example, and substance abuse disorder. In substance abuse disorder, it can also is mainly present in the recovery part of the process on the patient when the patient's trying to get sober. Now that you know about all these disorder types, it's very important to know the background. If the patient ever had any disorders in the past, it's important to report them immediately to the nurse, because then it'll be easier to recognize in the future if there's any signs of it coming back. Now, some of the signs that you can notice in a patient that will tell you there has been any change on their mental health status would be, for example, body tremors, where the patient would start shaking their body out of nowhere. That could be also associated with fear and anxiety, which are also other signs of the patient. It could also be related to delirium and hallucinations. In delirium, the patient would start shouting out of nowhere, for example. Hallucinations, start seeing things that aren't there. Or, for example, even having this itchy reaction, for example, thinking there's something crawling on their skin. Lastly, you can also add heart palpitations, though, for example, to the feeling of fear. And also, you can, for example, see seizures in some patients due to a combination of all of these other signs. And now that you know about all these other signs, this is how you would be able to notice and report to the nurse immediately any changes on their mental health. Thank you.